Thank you for joining us for 5 on 5. I'm Joe Sullivan, pleased to be joined by former Oregon Governor John Kitzhaber. John, thanks for stopping by. I appreciate it.
Thanks for having me.
So 2015 was the last time you were Oregon Governor. What's been keeping you busy for the past 10 years?
Well, recovering from politics.
Okay.
First start. I'm spending a lot of time on healthcare, a lot of work on early childhood, trying to prevent some of the downstream problems that we see in our educational system, our healthcare system, and doing some interesting work on forest health and housing. So keeping busy.
What about the big, beautiful bill signed into law this past summer, federal law? How is that going to impact rural Oregon healthcare?
Yeah, you know, it's a very controversial bill. The healthcare system is badly broken. Unfortunately, this bill doesn't fix it. It basically cuts huge amounts of money out of the Medicaid program, and people in rural Oregon are disproportionately dependent on that for access to health care. So in eastern Oregon, in this congressional district, it's about 40% of people could be at risk of losing access to medical care. And you know, the thing that I think the federal government didn't take into account is when people lose health care coverage, they don't disappear. When they get sick enough, they go to the emergency room, which is one of the most expensive care settings. I used to practice in the ER. And then those uncompensated costs are shifted to employers through increases in premiums. So it just drives this vicious cycle. So we need to fix the healthcare system? Absolutely, particularly for rural parts of the state, but this is not the way to do it.
You've said, as governor, the power to bring people together was one of your most important and satisfying things. In this polarizing political environment, do you think people can come together? And if so, how?
Well, I think they can. I mean, I've seen it over and over again. I think, I'll be really candid, I think the two-party system has become a huge part of the problem. You know, the campaigns are about the acquisition and retention of partisan political power rather than the exercise of that power to actually solve the kinds of day-to-day economic problems that people struggle with here in Oregon, and particularly in rural parts of the state. And I think we need to move beyond that. Sometimes I think we've been caught in this false negative narrative of extremes, red states, blue states, left and right, Republicans and Democrats, division and blame. And I don't think people like it very much. It's not very comfortable to be in. It certainly doesn't solve the problems that we want. And I think it's a choice. You know, I represented rural Douglas County for many years, and we worked really well with the rest of the state because we looked at each other as human beings, as fellow Oregonians first, and not as people who belong to political parties. And we need to remember that we are all in this together.
That's an important part of it.
Yeah.
All right, stay with us. We'll be right back with part 2 of our 5 on 5. I'm Joe Sullivan. Welcome back to part 2 of our 5 on 5 with former Oregon Governor John Kitzhaber. How is the first 1,000 days of your program that you're working with, Upstream and the Child Success Model, going in Southern Oregon?
Yeah, so there's this growing body of scientific evidence that shows that maternal stress and poor nutrition before conception and during pregnancy can dramatically increase the likelihood that children will have poor cognitive functions and learning disabilities and behavioral health issues and the early onset of a lot of chronic illnesses. So we've started something called the First 1,000 Days Upstream Initiative. It's got 5 design pilots around the state. One of them is right here in Southern Oregon, to try to develop a local delivery model to make sure that pregnant women can get access to everything they need in that first 1,000 days of life from conception to age 2 to put them on a path to success.
So what you're saying is when the mother is pregnant, this has to do with stress levels, cortisol levels rising in her, passed on to the unborn. Is that correct? Is that what you're saying?
Yeah, it basically alters the genetic expression. That is how it doesn't change your DNA, but it changes sort of how different those genes are expressed. So, for example, kids who are born from a mom who's been under tremendous stress, let's say from poverty, or not knowing where the next house is going to come, or poor nutrition, which is a real issue right now in Oregon, those kids can have an echo effect. They can actually be set back in terms of their likelihood of success in education. So a lot of the poor outcomes in education, a lot of the poor outcomes in healthcare are actually programmed in very early. And if we spent just a little teeny bit of money ensuring that those moms are healthy and have access to everything that they need, have a stable environment, it pays huge dividends downstream.
So what you're talking about is prevention.
Primary
you're talking
prevention.
about paying it beforehand so the results afterward. Don't fix it when it's broken. Is that correct?
That's exactly right, and we don't do that very well in this society, right? You know, we spend a lot of money on remediation in our educational system. We spend a lot of money on chronic disease in our healthcare system. A whole lot of those things are preventable or modifiable by focusing on investment in the very earliest years of life.
Such an interesting topic.
Yeah.
What do you consider your single most important result as governor, your legacy?
You know, I mean, I think we demonstrated during the years I was governor that the Republicans and Democrats can get together and do big things. You know, we did the Oregon Health Plan, we did the Oregon Plan for Salmon and Watersheds. There's just examples all over the state, and I think that we proved that the so-called urban-rural divide is largely a myth. At the end of the day, we all want the same things. You know, we want to be able to take care of our families, earn a good living, make sure we can leave our kids better off than we are, and have a safe community where we have a sense of belonging.
Is there one thing as governor that you wish you had achieved, the most important thing you wish you achieved that you didn't, and you look back on it?
Yeah, I mean, I think we didn't get this notion, this first 1,000 days Upstream Initiative. I tried that back in 2000. We had something called the Oregon Children's Plan, and it was essentially trying to shift the focus of our budget, not just to taking care of problems on the back end, but preventing them in the front end. It's a really hard sell when you have all these problems that are right in your face, but it takes some discipline and it takes some vision to prevent some of these problems, and most of them are preventable.
We have about 30 seconds left. Is there anything else you'd like our viewers to know about?
Well, I appreciate the invitation. It's like coming home. You know, I lived in Roseburg for 18 years and practiced medicine up there. I love Southern Oregon, and I just learned that Rogue River's open for rafting again.
It's nice to see you.
Thank you very much.
And thanks for stopping by. Stay with us. We'll be right back with more local news.